Hello everybody, welcome back to my channel. Thank you for coming back, joining me again on our YouTube channel where we discuss everything about the nursing in the UK, how much we earn, our salary, our expenses, our exam preparation. In my previous video you have seen that I made videos about OET, CBT, and particularly nowadays I'm making videos about OSCE, which is the second part of NMC registration. So the first one, as you know, is CBT, and the second one is the OSCE that we do here in the UK. So let's start the video without any further delay. Particularly about subcutaneous injection, when you get a skill, subcutaneous injection. I've already made a video about subcutaneous injection, but that was in a hospital setting. But what if you are going to a community, and what kind of form you get to fill when you give us any insulin or any kind of subcutaneous injection in the community. So today I have the forms with you. I'll show you the correct procedure of doing the subcutaneous injection. If you haven't seen that video, please go back and look at the video. It's more in detail. Today I'll just show you the form that we need to fill in subcutaneous injection. I forgot to mention in the previous video what is the form that you need to fill, and I'll show you in this video the form of the subcutaneous injection that you're gonna get in the exam and what is the procedure of filling it out. So this is the form, skills station for subcutaneous injection. I'll put a screenshot on the video. So it says the first thing is candidate name, then you get your scenario, and it says please read this insulin prescription chart carefully. You may refer to the brief during the assessment. So the scenario, the next point is it will be filled on the exam day. The next point is all the equipment you need is provided. Please administer Lantus Levomir safely using the prescription below. It is today and it's 1200 hours. So this is our assignment of the day, that we're gonna give Lantus Levomir safely and today at 1200 hours. So let's do it. I've explained you all the pre-procedure. I've explained the introduction in the previous subcutaneous video. If you haven't seen it, go back and check it out. And then after pre-procedure, safety check, patient ID check, and your introduction, you start with the equipment preparation. After the equipment preparation, you start with your actual procedure. So we'll discuss with the actual procedure. I've checked patient ID. I've checked all the details. If you see on the paper here, patient details will be all pre-filled. Patient name, address, postcode, date of birth, allergy, it will be all pre-filled by the doctor, by the GP. It also says today at 1200 hours, prescriber signature and date, medication name, dose and batch number. This one we can write it, or we can write it here, batch number also, the injection which we are using, and after giving the injection you're gonna sign it here, date and time, and then also you're gonna write your nurse's note after giving the injection, then your print name, signature, date and time. This is a tiny form. If you get heparin, if you get insulin or whatever subcut injections, this is the tiny form you're gonna get if you are going to the community for the skill station. Yeah, if you're going in the community, this is the form you're gonna fill it up. Again, the procedure is same as implementation, is the same. Everything is the same. You need to check patient ID, you need to introduce yourself, purpose of your coming to their house, and also you need to explain that if they have any, you need to ask them if they have any allergies, what is the reaction of that allergy, and it's the procedure of any medication, whether it's peak flow meter, peak flow is just the reading we get, right? So AIM, inhaled medication, whatever medication, whether it's inhaled medication, subcut injection, IM injection, whatever injection, whether it's implementation station or whether it's a skill station, you need to know the basics of the medication given. You need to check the 5 rights of the medication. You need to know whether this prescription is valid and legible. So you're going to follow the same procedure. You're going to say it out. This prescription is valid and legible. I am happy to proceed. But here, Lantus Levomir we're giving. Yeah. So make sure you know the patient blood sugar level before you give the insulin. And also If you're using the open vial, should not be open more than 28 days. Just check the date of opening and check the date of the expiry as well. So same thing, same procedure for all the medication. This is our short video for the community subcut injections. That's it, guys. I hope you like this video, and I'll see you soon in the next video. Thank you for watching.